Good afternoon, everyone. Welcome to our webinar for today. You can type any questions that you have during the time when we're talking into the chat function on the box. Mark is monitoring those, and we'll be passing the questions along to the four of us who are here on the panel. If somebody wouldn't mind, just as we're getting started, going ahead and typing into the chat box that they can hear us, just so we can confirm that on our end, that would be great. So if somebody will do that right now really quickly, we'd appreciate it. Okay, we're good to go. Thank you. So we're going to take a minute here to go around and introduce ourselves, and then we'll launch right in. So my name is Tim Parsons. I work in the Office of the Dean of Students, and I'm here to support students for all kinds of things they're dealing with, but certainly sickness is one of those, and we'll get more to my role a little later in the presentation.
Good afternoon. This is John M. Jeep. I'm a professor of German Studies, representing the academic side of things.
My name is Marie Kerr. I'm one of the certified nurse practitioners at the Miami University Student Health Services, providing the care for the student when they come in.
And I'm Cindy Traffican. I'm the practice manager at the Student Health Center. And I will be starting to walk you through a quick set of slides, and we want to make sure that we allow plenty of opportunity for question and interaction. A real quick overview of what we'll be covering today. We'll be covering an overview of the services we provide, area health providers and after-hours care that's available, and staying healthy as a student, which I know that we're all interested in, communicating with professors and faculty, and then obviously allowing and taking questions. Those are your panel for today, those of us that have just introduced themselves. A little bit quickly about the Health Center. We're located on 421 South Campus Avenue. We are right next to the Campus Avenue parking garage. Our approach obviously is not only in treating ill students, but in preventing, doing health prevention and wellness. So we do have a holistic approach. We are working with the students when we interact with them to transition them to becoming more independent and becoming more confident in managing their health care. Our hours are Monday through Friday, 8 to 6, and Saturdays 10 to 2 during when school is in session. Summer hours, we're open Monday through Friday. We try to handle and accommodate walk-ins, but when we are busy during flu season and we are seeing an early a surge of students coming to the clinic, we do strongly recommend calling for an appointment. And the earlier in the day they call for an appointment, the likelihood that we're going to be able to get them seen that same day. We make every effort to see the student on the day they call. Parking, they can park in the Campus Avenue garage if they have a car. It is right next door to the Health Center, and when they leave the Health Center, we will give them a ticket, we'll validate their parking, so it's free of charge. After they've been to the clinic the first time, we are an electronic medical record called EPIC. Many of you may be familiar with EPIC from your own physicians. After they've arrived at the clinic and they have activated their MyChart account, they can then schedule appointments through MyChart electronically in the future. Again, our phone number is here and it is posted on our website for that first call, or any other time we will certainly always make an appointment by phone call. We do have a no-show or late fee policy, and it is strictly enforced, especially in busy times when we're turning students away, not able to accommodate, and so we do charge for no-show fees. We will certainly accommodate a cancellation at any time. We ask that they give us 2 hours notice, but if they do call to cancel, we do not charge them for a no-show. Services provided, we have a host of services that Marie and the rest of the care team provide. Primary care, so we can engage as the primary care provider with your student. We do acute and episodic care, so general illness, minor urgent illnesses, acute care illnesses. We provide injury care, sprains, strains, minor lacerations, a variety of injuries that they might have occurred. We can provide wound care after surgery. A lot of students will return from breaks having had a surgery while they're home, and we can do follow-up care for those. Immunizations and travel medicine. We do provide a full complement of immunizations and also the travel medicine. So if they're traveling abroad, they can come in, meet with a specially trained nurse, We'll go over the country that they're visiting and the recommended by CDC medicines that they should consider having before attending or traveling outside of the country. We have a women's health practitioner that specializes and sees the female women's health population, and the rest of our providers also provide health care for the male population as well, sexual health care. We do treat sexually transmitted infections, and we also do testing as well for those, both males and females. We do medical follow-up. We manage the medical management of eating disorders, anxiety, and depression. We provide wellness physicals, so those preventative annual preventative exams. We also do work and school and sports physical exams as well. We have 2 MDs on staff daily and 7 certified nurse practitioners who are all certified in family practice. And then we do have the nurse practitioner that's certified in women's health. We have visiting on-site sports medicine and physical therapy, a sports medicine physician, and a physical therapist is a PhD physical therapist. The rest of our clinical team is rounded out by a complement of registered nurses, medical assistants. We do have a fully functioning laboratory. We do take walk-in outside lab orders, so if a physician from home is ordering reoccurring labs, your student can come in and get those drawn at the clinic. We do point of care testing, meaning rapid testing, so they can have some results, and then we also send out lab testing for more complex things. We have an on-site pharmacy that is open from 8 to 5, Monday through Friday, and then our administrative personnel. As far as billing and insurance, we are registered as a physician's office, a physician's practice, so you will see the typical copay for a physician office visit. We are not billed out as an urgent care or an emergency room visit, which is typically the most cost-effective approach with a physician office visit. We do third-party bill your student's insurance directly, so they do not have to worry about having money on hand the day of. We will third-party bill, and when the insurance pays their portion, any deductibles or co-pays will come back onto the student's bursar account. So you will just see a general health services part and a bill on that. So it'll just say health services. If you need detail, you can look at your EOB on the insurance plan or certainly call the clinic. And we need a copy of their insurance card when they arrive so that we're making sure that we're getting that billed. If we do not have their insurance information at the time of the visit, we most certainly will continue to see that student, but we do instruct them with a pretty strong language that they need to make sure they bring their insurance card within the next 24 hours back to the clinic so that we can make sure that we get the insurance billed. Those will drop to what they call self-pay after 48 hours, and the entire amount will land on your bursar account. So if you see a bill for health services that seems larger than it should be, it could be the fact that the student did not provide insurance information, and we went ahead and provided care, and then it's billed as self-pay. If that happens, simply call the clinic. We'll pull the bill back once we have the insurance information, and we will appropriately rebill the insurance. But we encourage, obviously during orientation, we remind students that they need their insurance card, not just for the health service, the health center here, but for any other health services they might need in the area, they're going to need that insurance information. Oftentimes, if they don't want to carry the card, a lot of students will just take a picture of it with their phone, the front and the back of the insurance card, and then that information is always with them. As far as health information for students to keep in their phone, again, the picture, front and back of their insurance card, we recommend if you're okay with them storing that information on their phone. The ICE information, which is in case of emergency. Again, in the case of an emergency, law enforcement will look if they can get in, if their phone's not locked. Oftentimes they will look for that information. Primary care provider and any specialist names that they know that they're under the care of is always helpful. The name and address of those physicians that are providing additional care and any contact information. we will certainly make the extra effort to track down any additional information we need and help the student figure that out as well if they don't have all that detailed information and we feel we need it. Any food or drug allergies, certainly the student needs to be aware of and can help identify that when they meet with their provider here at the health center. Vaccination dates, always good to know when's the last time they've had a flu vaccine, HPV vaccines, etc. We do collect on all incoming freshmen vaccinations for the CDC scheduled vaccination, recommended vaccinations for MMR, Tdap, mumps,
sometimes what
hepatitis B,
and sometimes what happens is you've sent that vaccination documentation in because it's due early during them applying, and then they go for their physicals with their pediatricians or family physician, and we don't always have the most up to date, and that tends to be the students that stepped on a piece of glass or cut themselves, and we don't have that Tdap information for their tetanus. So it's always good for the student, or they may land at an urgent care somewhere that's not student health that doesn't have access to those records.
So good information to have handy. Any daily medicines that they're on, they need to, really need to understand what they're on and typically why it's for. We certainly can help them identify what they're on or why they're taking that medicine. We can help identify that if they don't, but it's always certainly advisable that the student themselves understands what they're taking if they're taking any daily medications. And again, our phone number to the clinic is always a good thing for them to have in their phone. Student-patient privacy, we do fall under the jurisdiction of HIPAA, which is Health Insurance Portability and Accountability Act. It is a federal law. It guarantees privacy of all healthcare information, and we are held accountable to that to maintain that standard and protection. If the student is less than 18 years of age, they do need a consent to treat signed by the parent, one of the parents, which will allow us to provide care. We cannot provide care unless the student has that signed if they are a minor. If they are 18 or over, we do need what we call an involvement of care form and signed by the student, has to be signed by the student, which will allow us to share or discuss any healthcare information while they've attended the clinic, while they have been seen at the clinic. We are not allowed to discuss any aspect of their care. We're not even allowed to acknowledge whether they've been seen at the clinic if this involvement of care has not been signed. So it's a conversation we strongly encourage that you have with your student, whether they are going to be expected or that you prefer to have that involvement of care form signed. Now, please know that sometimes the parent has an expectation that they will be signing involvement of care, but once the student gets here, they may elect not to have the involvement of care signed, or if it's been signed when the parent is on campus, the student on the next visit may revoke that involvement of care. So once that involvement of care is no longer in effect, we are not allowed to talk with anyone else. So again, we are legally required to respect their privacy and guarantee that healthcare privacy. The consent to treat, a question that's been passed to us. The consent to treat form, the consent to treat for minor is on our website. And obviously, if the student is over 18, they sign the consent to treat, the acknowledgement of privacy rights that we provide to them, and an opportunity to sign the involvement of care form once they come to the clinic. We do not provide the involvement of care form on our website because we need to witness the signature of that form by the student themselves. So thank you for those questions, great questions. Weekend and after hours care, McCullough Hyde Memorial Hospital is fully accredited, fully physician medically staffed hospital here located in Oxford. They do have a fully board certified medical staff on board, 24-hour emergency room. So it is just a few blocks from the health center. Oxford Urgent Care is open here in town on Saturdays and Sundays from 10 a.m. to 6 p.m. There's Ross Medical Urgent Care that's open Monday through Sunday from 10 to 8, just a few miles south of town. Urgent Care of Hamilton, which the VCRTA bus route does run to, and that is open 7 days a week from 8:30 in the morning until 8:30 in the evening. Our pharmacies are located, obviously here we have one at the health center, And external pharmacies are CVS, Kroger, Walgreens, and Walmart are the national pharmacies available. We do, through our Epic medical record, do e-prescribing, so we can send that directly electronically, the prescription, to one of those pharmacies if your student prefers they be filled at one of the external pharmacies. We're more than happy to do that. Staying healthy as a student is a big topic, and certainly a big topic right now as we're already seeing a very strong demand for healthcare services here at the clinic. Disrupted sleep patterns, poor nutrition, stress, proximity to large groups of others, new environments can be contributing factors in communicable disease spread. So all things that are contagious, they tend to share a lot of. A few tips for prevention strategies would be proper nutrition, so encouraging your student to eat well, which can be a challenge. Adequate rest also can be very challenging when they're getting adjusted to a brand new environment and a brand new way of living. Exercise and stress management is always important and conducive to staying healthy. One of the most important things that we can and do encourage is frequent hand washing. Almost all communicable diseases, the common viral diseases, flu, GI viruses and bacteria can be spread through touching your hand to a soiled surface, a contaminated surface, and then touching your eye, scratching your nose, etc. So viruses and some bacteria could be spread very easily by the hand. So frequent hand washing is strongly encouraged. Obviously, soap and water is the best. If they don't have access to it, the hand sanitizers certainly are encouraged as well. So that's probably one of the most key things that they can do to help keep themselves healthy. Avoid sharing drinking glasses and utensils. Obviously, that can be a common practice. Flu vaccination, another very key thing. We're getting word that flu season is, they're anticipating an early flu season. Our serum is in, and we will begin giving flu vaccinations on Monday. So we will start vaccination. We just got our serum in, and so we do have flu vaccination available starting Monday. STI prevention, safe sexual practices, obviously something that the student and we certainly promote awareness of staying safe for sexual practices. We are offering off-site flu clinics around campus for the next 2 months. So those will go up and be publicized. They will also be posted on our website. So we're trying to make it as convenient as possible. We do take walk-in flu vaccination requests. So if they're walking by and want to get a flu shot and come into the clinic, we'll get them vaccinated quickly and on their way for a flu vaccine. So again, we're hearing from CDC that they're anticipating an early flu season. Last year, flu season nationally and what we saw here really did not hit until late January, early February. So, but they're kind of suggesting this is going to be an earlier year for flu. So think about flu vaccination. Again, communicating with instructors, and certainly Professor Jeep has a lot of good probably advice as well here, but we encourage the students to be proactive. Certainly if they've been sick or are struggling, they need to be proactive in communicating and opening the lines of communication with each one of their faculty members. The excused absence policy on campus is that we don't excuse absences. So I'll let Professor Jeep talk about the relationship with the academic side and being ill.
Yeah, I'd be glad to do that. Thank you very much. And thank you for that very clear presentation. I learned a lot myself. Communication with instructors, that is a key to success. For me, and I think for all of my colleagues, every class is a learning community. And the community consists of the instructors and consists of the students. Communication is of the essence. Every student receives from every instructor for every class in a semester a syllabus, and the syllabus clearly outlines the expectations for attendance, the consequences of not attending, if there are any, and the different types of absences. Absences for religious holidays are the norm. It's very helpful if you inform the professor ahead of time that a religious holiday is upcoming, and these are excused absences. The work that's covered, however, whether the student is in class or not, is a responsibility of the student. And again, communicate with your instructor. I'm talking to the students now. The students communicate with the instructor, and there are many workarounds for any kind of absences. The instructor welcomes it when the student writes and says, I have a communicable disease, I'm being treated, I'm not coming to class because I don't want to get everybody else sick. Instructors welcome that, and then it's appropriate to ask, what can I do to cover the work in class? I make comparisons to either performing in a symphony orchestra or on a sports team. If you don't show up, you can't play the instrument or play on the field. And so being in class, and there's a high correlation, a very high correlation between attending class and student success. Students who don't come to class are much likely to do less well in their performance. The student comes to me with some difficulties, be they physical or be they psychological. I tell them if they break their finger, I'm not going to touch it. I'm going to instruct them to go to a qualified health professional who can I'll tell them where that is. Same thing with a psychological challenge. I'm not going to try to treat it because it's not my job, but I will instruct them to invite them to visit the health center where in certain circumstances they will be seen immediately, and in other circumstances they will be seen as soon as possible. We're also encouraged to contact the Dean of Students when we notice, and we often do in our classes, that something's going on. Student who's been faithfully coming to class isn't coming to class and there's no notification. Student seems to be disheveled, too tired. We will notify the Dean of Students, and the appropriate people will then contact that student. In a serious case where a student needs to miss a long period of time, it's possible to request through the Dean of Students a medical withdrawal for a given semester. These are generally extreme cases. I don't think there are very many of them in any given semester, but they can occur. And so a student and the people responsible for the student should know that that is an option in case someone needs to be out for an extended period of time for health-related reasons. I think I'll leave it at that unless there's a question.
Okay, and this is Tim from Dean of Students. I'll just pick up here for a couple of minutes and give a couple of more things. Our office takes a lot of referrals and phone calls from faculty and from parents as well. You know, in some cases, we have faculty that have spoken with one of their students, and the student then comes into the Dean of Students office. Sometimes the student doesn't always understand why they're there, and one of the things we get from students sometimes is, well, I told my professor I was sick and going to miss class, and they told me I have to come here to get an excused absence from you. You know, I will be real clear with that student that we, as the Dean of Students office, do not excuse absences in any way, shape, or forms. We will help with communication with more serious cases, which I'll get to here in just a minute. But what I'll often do when that comes in, I will ask the student for the name of the professor who told them that and sent them here. And then I will write that professor directly and just say, thanks for sending the student our way. We do not excuse absences, but I did want to confirm to you that they did come and follow through on that advice. And most of the time, the professor will say, oh, thanks very much. I didn't send them there for an excuse. I just wanted to make sure you knew about it so you could help support them. So that is one thing we run into. Our office, under a couple of very limited circumstances, will send out notifications to a student's professors. The two areas, two times that when we do that, when we are informed and we've received some documentation that the student has experienced a death in their immediate family and has to leave campus, of course, we will send that information on to their faculty, which lets them know not only what's going on, but that we have in fact verified what the student's telling us as well. So they can, and then the student can work with their individual faculty to determine how to handle the time that they're away. The other circumstance where we will send one out is if a student is experiencing an emergency hospitalization. So if we get word that the student has gone into the hospital, you know, maybe they've been in an accident and transported, perhaps they're in for surgery, something like that, we will communicate that to faculty as well. We do not communicate any level of detailed medical information to faculty. We will simply say the student has experienced a medical emergency or the student has been hospitalized. We don't consider it our job to communicate the specifics, and we leave that up to the student to determine how much and what they want to tell their professors. Professors are generally quite flexible when they get those notifications from us. We will send some other notifications under limited circumstances. Occasionally the health center will contact us and ask us to send one. I think in more serious cases or where something is highly communicable or something like that, where the student's been ordered essentially not to attend. So if we get one of those from health center, we will certainly do that, and the same from the counseling center as well, but those are not common things that we receive. In the more serious cases, and Professor Jeep had referenced this, where a student is going to be out for an extended period of time, and I would say that there's no specific length of time a student can be out before they have to consider withdrawal. You know, absences, as Dr. Jeep indicated, are up to the discretion of faculty members. But what we tend to find is if a student is going to miss 2 weeks of class or more, probably a discussion about withdrawal is going to come into the picture, because that's a pretty big chunk of class to miss, especially when, even when they're coming back, they may not be back to 100% health yet. So we do have a medical withdrawal process. I am the one that administrates that on campus, so I'm kind of the only one a student or a family has to deal with if it's going that route. We do have a website which has come up here. It's on the Miami website. If you just in the search box type medical leave of absence or medical leave, it will come up. And I do want to clarify something with this. This process is actually a complete withdrawal from the university for the semester in question. So we'll occasionally have a call that a parent will say, well, my student needs to go on medical leave of absence for a month. Well, we don't really have anything that is a temporary leave of absence. That would be something they'd have to work out with their faculty. We could maybe help with the notification. If a student is filing formal medical leave of absence papers, what they're really requesting is that I be withdrawn from all of my classes for this semester. And keep in mind that it is for all of their classes. Occasionally a student might go to a professor and tell them they need to drop their class because they have medical issues, and they might get sent to our office and they say, well, I need to medically withdraw from this one class. Well, you can't do that. You can't medically withdraw. There is another process we can help them with that doesn't go through our office, but medical withdrawal is complete withdrawal. On this website that you see there on the screen, up in the left-hand column there, it says MLOA forms. The top two forms, the student request form that the student fills out, and then the provider report form that their treating physician would fill out, are the forms that need to come back to me. This does cover both physical health and mental health issues, and we actually approve and process anywhere between 300 and 350 of them in a school year. So it's about 150 to 175 a semester. So it is actually, you know, a fair number of them. So if that is something that you think you need to consider, read the website. There's all kind of detail about the process, procedure, the financial aspect to it, and other things. Read through it, and then you just give our office a call and ask for me, and I will help walk you through the details. None of the paperwork has to be filled out before a student leaves campus. So if they're dealing with a fairly critical situation, or as parents, you just want to get them home as soon as possible, what I will always say is just get them home. You can call me after the fact. We can get the paperwork from you that way, and then make arrangements to take care of the rest of the issues. Everything can be done from a distance, and the provider report form can be filled out by somebody they've seen here locally in Oxford or on campus, or it can be filled out by your doctor at home or whoever it is that they might be seeing. So don't hesitate to get them home. Contact me later, and then we can work through the details afterwards.
Let me maybe just add a little something from the instructor's perspective. And I appreciate that Tim said how flexible instructors try to be. Think of a class where every day there is group work going on. Missing 2 weeks of a semester is missing more than 25% of the interactions with those other groups. That could be significant. On the other hand, if it's not a situation where the student needs to give up the entire semester, but maybe just needs to tone things down, it's also possible to take to ask to be able to do the work after the end of the semester. And that's something that's negotiated with the instructor. The work does have to be done, completed in the following semester. But that's also an option for a student who's just somewhere in between, not quite being able to keep up.
And that's a great point, John, because a lot of times when a student and family is reaching the point of needing to kind of sort through these things, the answers to your questions can sometimes depend on where in the semester we are, early, middle, end of the semester. So honestly, and I'll kind of go back to just what I just said, you know, if you're getting into the situation and you need to just talk through your options, best thing you can do is call me in the Dean of Students office. We'll look at where you are in the semester. We'll look at what your academic load looks like, what you're dealing with, and then we will come up and come up with a plan. One of the other questions our office will get sometime, especially if it's earlier in the semester, a student might say, well, I have to go home for whatever this issue is, and I'm not going to be able to come back to campus. Can I just finish all of my classes online? My answer to that is always, well, you're going to need to contact your faculty to ask that question, but probably not. There may be some classes and some faculty that are able to flex it and do that, but in the vast majority of cases, that would take a major overhaul of the classroom, and it just would not be feasible to do. So again, calling and talking to me and working through your options, and then what I'll do is, if you want to explore some of the other options that don't include medical withdrawal, I will tell you where you need to go and give you the specific contact information you need.
I hope the message is coming across. I tell this to students, we're on their side. We want them to succeed.
Absolutely.
But it has to be realistic. And so there's so many different kinds of classes. A lecture class with a few hundred students is different than a seminar with 15 students. It may be that the final exam is 33% of your grade, and in my class it's 10% of your grade. So if I needed to miss that 10%, it would hurt, but it wouldn't be fatal. 33% is, well, it's not fatal, but it's damaging to a grade point average.
Another piece of information to add to the quote excuse topic, we do have students that will come to the clinic asking us to provide an excuse to have missed class, and we do not provide excuses as well. What we do provide to the student is a confirmation that they had a healthcare visit at the clinic. Again, it's provided directly to the student, and then what that student does with that information certainly is at their own regard of how they choose to share that. But it's just a confirmation of a visit. It has no clinical, no healthcare specific information on it. Just confirms and validates the fact that they were seen in the clinic at the date and time that they were seen. So we do provide those with visits. We're more than happy to provide those, but we do not provide excuses. I also have a question that has been posed that is a complex question. Does a durable power of attorney override involvement of care? There are two different types of powers of attorney. There is a healthcare power of attorney, which a lot of people will sign, and that is certainly specific to the event when the patient or the student would become incapacitated, that the power of attorney has right to step in. Then there's a broader-based power of attorney, which covers the ability to act on the behalf of the student for financial, legal, and healthcare decision-making. We have not experienced a request to this point of asking a power of attorney to override the involvement of care. If the student is requesting in writing that their healthcare information be protected and there is a power of attorney, that would be referred to our privacy officer, who is an attorney on a case-by-case basis, to make sure that we are not violating and we are protecting the healthcare rights of the student, but at the same time honoring the legal documentation that's being provided. So there is no one specific cut and dried answer, although great conversations to have. You have sparked some thoughts on our behalf. Our privacy officer did do a webinar just recently about this very topic, and so we can post some of that information on our website. Probably be valuable information.
One of the things that I would like to mention too, when a student's dealing with a medical issue, in some cases, one of the referrals I might recommend to that student is to consider contacting our Student Disability Services office. They deal with a lot of students who are in situations, both short-term and long-term. One that comes to mind quite frequently around here is when students have experienced a head injury, have had a concussion, maybe from a sporting event, maybe from something else, but they're dealing now with the after effects of that, which can be very unpredictable, very specific, very challenging because the length of time that those symptoms might continue having an impact on them can certainly vary from case to case. So our Disability Services office, if a student wants to consider registering with them, they can do that online through the Disability Services website. They have to provide some current, recent documentation of what's going on, which usually includes recommendations from their physicians about what kinds of things they might be experiencing and what kinds of accommodations might be warranted in their case. The student will meet with a person in that office, and they may approve accommodations, short-term or long-term accommodations for a student. The student would then be provided a letter that they can give to their faculty. Again, the responsibility and control of the information remains with the student. So they have a letter that they can provide to their faculty, which would identify that they're registered with their office and that they've been approved for certain accommodations, which then faculty, of course, would will be more than happy to follow. So that's just one of those other sources to keep in mind. This is especially, if you've had a student that's been dealing with something and now they're returning to campus, but they may not be 100%, there may be some lingering effects of things here or there. That might be a great office to consider to help in the support of a returning student.
Yeah, and I can substantiate that. I've dealt with that the last number of semesters, a student with more or less severe head injuries and needed accommodations, and that meant in one case that the student took his exams in a more quiet place than a typical large setting would be with fewer distractions. A couple of weeks later, he seemed to be better and rejoined the class, so that certainly happens. Another question, and thanks so much for your questions, was asking about incompletes. If a student asks to take an incomplete, this is negotiated with the instructor, and it's negotiated what needs to be done to complete the work. Question about if they missed a final, it could well be that a similar final would be designed that the student would take at a different part in the semester, but that's only part of the package. Anything that needs to be completed needs to be completed. It's not just a question of a final exam taking care of everything.
One of the questions we will get sometimes in the Dean of Students office on that, if a student's in a serious accident, as an example, toward the end of the semester, they've been a good student up until that point, they've been a regular attender, is will the faculty consider just giving them the grade that they've earned at that point and not requiring additional work to be done? And my answer always is, well, maybe you'll just need to ask the faculty. Again, there's a lot of factors that would go into that decision, the type of the class, the type of work still needed, what percentage of the actual grade that made up, lots of questions that only the faculty can answer. So we will just encourage them to reach out to faculty. If a student is in a situation where they themselves are hospitalized and unable to interact with faculty, we will get the information from the parent and help moderate, for lack of a better word, with faculty. We'll let faculty know what's going on. In some cases, we'll just tell faculty, look, it may be a month or 2 months before you hear from this student. Please just kind of keep them on the back burner for now. We'll update you as we get more information.
Right, and institutionally, for all of these scenarios, there are things in place. And so if it's my best decision to give the student an incomplete, and that's what I do, and things move forward.
This is Marie Karen, one of the nurse practitioners at Student Health Services. One of our most prominent visits, especially in the fall, actually throughout the year, is if you're not familiar with Southwest Ohio, we have tons of allergies in this area, as you hear my little crusty voice this morning. And a lot of students who are not from this area are unfamiliar with that, and a lot of times when they come from somewhere else, they have not experienced allergy symptoms in the past. So when they arrive to campus, a lot of students will come in. Just this week I had a young lady come in, or multiple ladies come in, saying, I've had I've had this cough and I've had this nasal congestion since I got here August 21st. It won't go away. I've tried everything. I've been on antibiotics 3 times. I'm still coughing. So antibiotics is not the answer for allergies. Not that there are not some students that may indicate a bacterial infection, but allergies can mimic a viral or a bacterial infection, but truly just need to be allergy management. So a lot of students you'll see, your student may come in, we will assess them, one of us, see what the recommendations are, but allergies are very prominent in Southwest Ohio. A lot of allergy medication is over the counter that they can purchase on their own, but if they feel like they need direction or you feel like they need assessment and direction, obviously we are there to help guide them and manage their allergies and keep them healthy while they're here. Sometimes, many times, students will come in, they'll go home, wherever home may be, whether it be Columbus or whether it be Connecticut, and they feel much better because they took a magic Z-Pack. And then when they come back to campus, they feel that they're sick again, and the magic Z-Pack will make them better. But probably wasn't actually the Z-Pack or azithromycin that made them better. It was because they were out of our little pod in Oxford and not exposed to the same allergens in the air, and that they started improving on their own, and then when they came back, it came back. So that's also kind of a little test to show that things that might be part of their concerns or problems. So with the student health services, we also want to share with you that we address the allergies very aggressively here on campus, but also that antibiotics are not the answer to everything. If you look at the CDC, Centers for Disease Control, recommendations for upper respiratory infections 90% of the time are not antibiotics. They are symptom management, whether with decongestants, cough tablets, ibuprofen for fever, aches, pains. So we try to manage their symptoms the best we can to get them the most productive and successful in their classes. Obviously, if it's a bacterial infection or indicates antibiotics, we are more than happy to prescribe those. But antibiotics are not the answer to every upper respiratory infection, and I think a lot of times students feel that they are because they know once you're on antibiotics, if it's bacterial, that you respond quickly and feel better. And we all want to feel better quickly. And a day or two of classes to a student can be very challenging and overwhelming. So obviously we want to do symptom management to get them back to classes as quickly as possible. If I miss a day or two of work, student health services will miss me maybe, but it's not going to be as detrimental as a student missing a couple days of classes. I can see where it would be very difficult for a student to keep up. So our goal is to do the best symptom management we can and keep them in classes actively if we can.
I have a question. This is Cindy Traficant. Question posed to students with type 1 diabetes, do we fill monthly insulin? Great question. We only carry Humulin R due to the cost and the fairly rapid expirations of the other more costly insulins to keep our cost containment under control as well. So we do provide and can fill a prescription for Humulin R insulin, but the others are handled through the local national pharmacy chains. And pharmacy brings up a great additional topic of pharmacy billing. As I had mentioned, we do direct third-party bill your insurance company for the office visit, any lab or other treatments that they've received at the health center. The one exception to billing direct is a pharmacy. Our pharmacy does not bill third-party companies directly, so your insurance company would not be billed if your student chooses to get the prescription filled at our pharmacy. Sometimes it's the weighing the convenience of having the prescription filled right there before they leave the clinic. The advantage for us not direct billing third-party insurance is that we can keep our costs down. We have a very tight formulary, and our medication costs are maintained and kept down, and we certainly pass that benefit of lower costs onto the student. So a lot of our prescriptions will cost anywhere between like $4 and $10 to be filled. You can, and our pharmacist does provide all the documentation you need to directly submit a claim to your insurance company for reimbursement. So they will get reimbursed for the prescription once you've directly filed that claim with the insurance. And our pharmacist, Jim Benson, will educate the student on that process, and we help them every step along the way to make sure that happens. Now, Oftentimes what will happen is the student will leave with the prescription filled and the receipt and the documentation to file the claim and get reimbursement directly back to yourselves will go in their book bag and or the trash on the way out. And it's when the Bursar accounts are due that you're seeing a charge on your Bursar account that there's a question about what happened. We're more than happy to get that that information reprinted and in your hands so that you can file that claim yourselves. But most of our pharmacy charges are relatively low. One of the exceptions is Tamiflu. We carry Tamiflu. Tamiflu is expensive nationally. We certainly pass on practically just the cost of the medication, but it is over $100. And so that charge goes directly to the Bursar account until you can file a claim. We do educate the students before we fill anything that's expensive. And sometimes we will say, this might be expensive, this might be something your parent would prefer that we fill at CVS, that you fill it at one of the national chain pharmacies, so it's directly billed by them. It doesn't go onto the student's Bursar account. But our costs are typically low with the exception of Tamiflu. Last year in town, because we are aggressive with ordering Tamiflu and because of our healthcare academic coalition that we have with our suppliers, we get priority billing for Tamiflu, and so we can provide the Tamiflu or the generic. We carry the generic as well, but oftentimes we'll be the only place in town that has Tamiflu. So sometimes they're kind of out of options. So that's a little bit about pharmacy billing.
Along with Tamiflu, it's not quite flu season. We hope not yet. But remember that Tamiflu is only effective if they take it within the first 48 hours of symptoms. Following 48 hours of symptoms, Tamiflu is not recommended because Tamiflu does not stop the flu. It just reduces your symptoms and length of illness. So if you've already been sick for 48 hours, flu is usually 5 to 7 days, but the Tamiflu is not going to be effective in reducing that length of time. So that's something that we as providers try to be conscientious of what's best for the student, and also on it, hopefully it will best for the student as far as their management. Obviously, if they come in with flu and they're not a candidate for Tamiflu, we would do symptom management with some decongestant, some cough tablets, ibuprofen, treat them as aggressively as we can with their symptom management.
And we do provide rapid flu testing in the clinic. Once flu has definitely penetrated the area, we're seeing several flu on a daily basis and kind of saturated with flu. There becomes a point when it really is not even clinically necessary, perhaps, to test for, to do the rapid testing, because if they're symptomatic, the influenza, true influenza signs and symptoms are very classic, and the providers are obviously very experienced in identifying true influenza, and they're going to treat the influenza symptoms and not necessarily provide that rapid flu test, which would just drive up the cost of the care or of the visit. But certainly if it's something that the student is really concerned about and wants to know for sure, we would certainly provide that rapid flu test for them. I have another question posed. Does Student Health Center accept sharps boxes for disposal? That's a great question. I know that there's processes on campus for that. We certainly would accept one. We would not turn one away, but I believe the disabilities offices manage that, but we will have to check and post that answer back to our website and not have that question. But if someone brings a sharps box in, we will take it. We would not turn them away.
Okay, well, thank you all for tuning in, for listening to us. Of course, I hope you get the message, if nothing else, that we do have lots of care here on campus, and that we are going to do the best in every situation to work with your student to figure out what the best options and the best solution for them is. So please don't hesitate to contact us. This last slide's been up for a little while that has our information on it. Either contact the Student Health Center directly for health-related questions, or if it's a more general kind of information you need to explore, certainly reach out to the Dean of Students office in doing that.
And this is Cindy again, and I would encourage you or your student to never hesitate to pick up the phone and call, and obviously in our conversation. Oftentimes the student is communicating. You know, they may feel really, really bad, and you're 1,000 miles away, and you're picturing them on the doorsteps of death. And this may be the very first time they've ever experienced an illness on their own, and they really do feel awful. And if they have influenza or something, they really do feel like, you know, they're on death's door. But oftentimes, just a quick phone call to us, as long as the involvement of care has been assigned, will relieve you of your worry and concern. And certainly we can then combine our resources to support that student together, both from your part and ours, and connect that care so that the student's getting supported from both you far away and us here on, you know, from a clinic perspective. So don't ever hesitate to reach out and call and ask for information. We're always more than happy to include the parent in the plan of care. We actually like to do that. That involvement of care obviously has to be signed, but don't ever hesitate. Encourage your student, you know, not to worry about being judged. We have students sometimes who will wait a day or two, probably too long, and have kind of let themselves be miserable when they could have come sooner. They're afraid they're not sick enough. Other students, you know, come in and they're not really very sick from our experience, but they feel sick, and that's okay as well. We never judge those kinds of things. They're learning how to navigate the healthcare experience for the first time often by themselves, and it's a learning process, and we're going to support them regardless of what end of the scope that they're on. If they're totally dependent on the parent and or us and help guiding those, or they're fairly independent. So we see all students on both ends of the spectrum of their ability to navigate their health care, and so no judgment on either end. So encourage open communication.
One last question that's been posted to us here. If a student is very ill, as in too ill to email their professors, will the Dean of Students office help? And again, that would be a real challenge for us. We're not allowed to communicate medical information to professors. I know there are occasions where parents will actually send emails directly to professors. You are certainly welcome to do that on your student's behalf. Simply keep in mind, due to FERPA and some other things, while you may be allowed to pass information on to other people and professors, do not be surprised if you don't get any response back from the professor. The professor may email the student directly. In many cases, the professor may copy it and send it to the Dean of Students just to make sure we're in the loop, which is always helpful. But in many cases, the professor won't necessarily engage in a conversation with you, although they might write back and just say, thank you for the information. How, you know, let us know. And if you're not familiar with FERPA, it's certainly something you can look up, but it's the Federal Education Rights and Privacy Act, which essentially protects a student's privacy. Students do have the ability within the web system to go in and give parents access to certain information, but even that's fairly limited. You know, professors generally are not going to feel comfortable getting involved in detailed and in-depth conversations with a parent about the nature of the class, about the student's attendance, performance, and things like that. But they certainly could take that information if your student is too ill to deliver it to them.
That's along the same lines with the HIPAA, which is the Health Account Affordable Act, is you can, as a parent, can share information with us even if we cannot share information with you. So as a provider, sometimes I welcome when parents call, and whether it's a physical clinical concern or a psychological clinical concern, because sometimes you have parts to the puzzle that the student either A, does not feel that it is important, or B, does not want to share. So even though you share with me as a provider, you know your student and what this experience is, I may not be able to respond. I may be able to say, just thank you for making me aware of that. That doesn't mean that I won't listen and advocate for the student in that manner. It just means that I appreciate that information, and I will do my best to make sure your student is as successful at school as possible, as well as learning to empower and advocate for their own healthcare decisions.
And if we feel our provider team, this is Cindy again, if we feel the provider team feels it's in the best interest to open up those lines of communication, the providers will, you know, encourage the student to sign the involvement of care. The student can sign involvement of care for that visit only, and then, you know, decline future visits for involvement of care. So if they feel like it's something that you would really benefit and the student would benefit from being able to have a discussion and develop a coordinated plan of care, they will certainly have that conversation with the student that, you know, you might want to think about letting us call your parents, and or, while you're here, can we call your parents, et cetera. So, and I think Tim had mentioned also on the notes of communication, communicable diseases. Measles and mumps are always a threat on campus, mumps especially. There are several universities in the last few years that have experienced significant outbreaks of mumps. It's highly contagious, and it does require by health departments 5 days of isolation, 5 to 7 days of isolation, which means they can't leave their environment. Meals would have to be brought in, et cetera. In those events, we talk with the student, we encourage them, if they're in close enough proximity, to go home and continue to recover in their own surroundings. We do get permission if the student thinks that's a great idea and that they would like us to do that. In those particular cases, we will have the student sign a consent to release that we can then contact the Dean of Students to let faculty know that due to a healthcare condition, the student is not able to attend class for the next number of days. So we do not give a diagnosis. And again, sometimes the students are feeling pretty crappy and they don't want to take the time, but those are pretty much the only times that we would reach out after a consent to release information. Again, not specific information, but we would notify the Dean of Students to then let the students' professors know that they have been asked not to attend class.
One other question that was just handed, if in fact the student is too sick to leave their residence hall room, can food be delivered to them? My answer would be yes and no. The university is not permitted in those cases to deliver food to the student's residence hall room. We would recommend that the student and parent obviously inform the residence hall staff that lives in the building about what's going on, the RAs and the RDs. Under certain circumstances like this, the student can give their ID card to a friend who can go down and swipe it and get the food and bring it to them. Obviously, under most circumstances, we tell students never to give their ID to anybody, but in a case like this, that can be arranged. Best thing to do is just help coordinate that through the specific residence hall staff of the hall that your student lives in. Of course, we do have lots of restaurants and things around here that we'll do delivery to if a student wants to go that route as well. But obviously, if they have a meal plan, you don't necessarily want to be paying double by doing that. So,
another really great question is, can they get measles, mumps if immunized but immunosuppressed? Actually, they can get measles and mumps even though they've been vaccinated. It typically doesn't really even have anything to do with being immunosuppressed. Vaccine immunity can wane. It can lessen over the duration of time. And in the most recent mumps outbreaks, what they are finding is typically there's a source, the first patient that develops the measles or mumps has not been vaccinated, but many future students that come down with mumps have in fact been vaccinated. If there would be an outbreak declared, those outbreaks are declared by the health department, determined on the number of cases, and within the time frame that we have experienced. All communicable diseases of that nature are reported to the Ohio Department of Health and our local Butler County Health Department. Certainly we engage their resources in aggressively managing an outbreak. Once an outbreak for measles or mumps would be declared and/or dreaded meningitis, which is very serious, we would start a mass vaccination campaign. And those are covered in Ohio by the Ohio Department of Health. That is state specific. Many states do not cover the cost of vaccinations during a campus outbreak, but Ohio fortunately does. But it has to be declared an outbreak by the Ohio Department of Health for them to cover the cost. But we have aggressively managed active cases and students that have been exposed, that we have known exposures. We communicate and certainly encourage the consideration for what they call third dose MMR, so to reinvigorate their immunity. So great question.
Okay. Thank you for your participation and attendance today. We definitely appreciate it. We'll be more than happy to field phone calls with further questions and just let us help work with your students. So thank you. We'll be signing off now, and we hope you all have a good rest of your week.